Hey girl, hey, I'm back with a quick not my birth story time. And I wanted to tell you about why I like Cervidil. Now, if you watched my previous video from a while back on inductions of labor, you know that I mentioned that Cervidil is one of the medications used to induce labor. So here's a picture of Cervidil on the screen, and this is what it looks like. It's basically this white long string, and it goes in, sits at the door of the cervix, and it can be easily removed. Now, I stress that it's easily removable because I'm going to tell you about this story that I had with a patient. But I also want you to know that Cervidil is a 12-hour dose. You're usually brought into labor and delivery. The doctor will insert it and leave you to sit for 12 hours. I know I worked at one hospital where they would bring the patients in at night, put the Cervidil in, get the patient all admitted, and tuck them in and go to bed. And, we will be monitoring the baby remotely from the nurse's station. Cervidil is usually a very chill drug. Let me tell you about the story time that I have. So I was manager on duty at this hospital, and this patient was an induction, and she had Cervidil. And the patient's baby's heart rate kept doing deep dives. And we talk a little bit about fetal monitoring in our paid course, so I won't get into it here. However, it's significant that a baby's heart rate goes down. We call that a deceleration. And the baby was decelerating very low and kept happening. And there are various things that we do for intrauterine resuscitation, which means like to recover the baby, to try and make the environment pleasant for them again. It was not working for this baby. We turned mom over, we repositioned her from side to side, we gave her IV fluid boluses, we gave her oxygen for the baby, and the baby just was not responding. So at one point, one of the residents comes in the room, and I'm documenting like what's happening. We're doing all these things for mom, we're trying to recover the baby, and the doctor's like, I'm gonna pull the Cervidil. And I was like, I think you should. If that's what you feel like you should do, then you should pull the Cervidil. We pulled the Cervidil out because the baby's not tolerating any kind of contraction. Even though they were mild contractions, the baby was not tolerating them, right? So every time mom contracted, the baby's environment would be squeezed, and the oxygen and nutrients and blood flow would be cut off from the baby. That's what goes through the umbilical cord, right? So we had to pull the Cervidil because the very first step of induction, the baby wasn't able to tolerate it, which leaves us with only really one option, and that's a cesarean section. I want to stop here because I know there's a lot of misconception around C-sections. Some of it's true, but some of it is a misconception. Some would think, oh, the baby didn't like induction and that's why we had to go for a C-section. No, the baby did not like contractions. You have to have contractions in order to have a vaginal delivery. And that's just what it is. It wasn't the induction that caused the baby's heart rate to drop. It was the stimulation of the uterus to have contractions, which are necessary to have that vaginal birth that the baby did not tolerate. This patient goes back for a C-section, and guess what? This baby was never going to make it through labor because this baby had what we call a true knot. Now you're like, what's a true knot? A true knot, if you've ever tied your tennis shoes or your sneakers and you've double knotted them so that they don't come undone, and then you've been trying to get that knot out so that you can get your shoe off, get your laces undone, that's a true knot. This baby had a true knot, which is rare, in their umbilical cord, which means that knot was tied, and it was tight in their umbilical cord. So whenever mom had a contraction, it would squeeze even tighter. And so that's why baby could not tolerate contractions, which subsequently meant the baby would not be able to tolerate labor. So this was a save. It was a good catch. We pulled that Cervidil, got mom to the OR, delivered the baby healthily. The baby was perky and robust and just happy. And we didn't get to stress the baby out because we identified that this baby is not going to tolerate the beginning stages. So let's not even push the issue with this baby. So yeah, Cervidil is a great drug because we were able to get it out. If it were misoprostol or Cytotec, those are pills that are either taken orally or vaginally, and we can't retrieve those once they're in. So that's why I have a personal love for Cervidil, because you can always say, never mind, psych, I don't want to use that. But yeah, let me know if you found this story interesting. If you know anyone else who has had a baby that's had a true knot in their cord, or if you have had a baby that's had a true knot in their cord. And if you are into birth stories, I'll do more. If you found this interesting, share it to someone else. Like, comment, share, and follow for more. I have stories for days. Bye.